Are you in a hospital that's gotten these notices? Give us a call. I mean, it's confirmed. We're not asking you to confirm it. Give us your take on it. Dr. Davis in Florida wants to give us his take on this. Go ahead, Dr. Davis.
I think it's ridiculous to bring these patients back. It introduces risks that are just not reasonable. And like you said, you can put a level 3 containment facility on just about any Navy ship and keep those people away from the rest of the population. It only makes common sense.
Why do you think they're bringing so many Ebola patients back to South Dakota and Georgia and other states?
I can't even speculate because it makes absolutely no sense. Like I said, it creates risk where you don't have to have risk. It just doesn't make any sense.
What's your overall view of the Ebola epidemic?
Well, I think that from my perspective of running a biotech company that has a potential solution for this in a drug that we've developed and worked with the Army on it, all of the emphasis right now appears to be on vaccines. And I think that that's a mistaken solution because if you have hypermutation like you have in this particular viral strain, it's impossible to anticipate how it might mutate, which is the key to developing a successful vaccine. You have to look forward at where it's going to go, and you can't predict where this is going to go. So I don't believe that the vaccines that Glaxo or any of the other companies are trying to work on, even though I believe in those from a scientific standpoint, I simply don't believe that you can predict where this will go in order to make enough vaccines that'll make a reasonable protection for the population.
Sure. Well, you've been a guest on the show before. I'm glad you got in today. You want to write an article for us about that and send it over. We'd like to get your perspective on why an Ebola vaccine won't work at this point. Thank you so much for the call. Sean in Nevada is a doctor, works in an emergency room. Sean, thanks for calling in. Give us your take on the situation.
My take is that we may be dealing with something more than just spread by, bodily fluids. We get a CDC announcement today that you need to have a respirator, you need to have basically a level 3 biosuit to engage with these patients. That's becoming concerning to me that the CDC sends something out like that. Unfortunately, they can lag in their response to different infections. And then in the state of Nevada, if you're a licensed physician, you get notifications through the sort of infectious disease gurus out of Vegas, and they are now sending out a warning sheet of what to look for in patients who may have Ebola. And as far as I know, there are quote-unquote no reported cases of Ebola in the United States.
But now, because it takes weeks for it to show up before you know somebody's sick, I guess that's why they're doing this.
Well, my concern is that do we have a bunch of little time bombs walking around the streets of America that are going to suddenly explode and we're going to suddenly start having cases? And it certainly doesn't help, like Dr. Davis suggested, bringing in infected people, because none of us really train for dealing with this level of infectious disease. It's not commonplace for us to down up and deal with patients of this caliber in our emergency rooms here in America. And so it's really concerning that it's probably going to walk into one of our emergency rooms one day, and you're going to have staff that are going to be fearful to care for these patients. You're going to have staff that could become infected, and then ultimately other patients who are already jeopardized medically in the hospital becoming contaminated, and it's going to be a nightmare.
Well, I tell you, what do you make of the Typhoid Mary scenario that some of these people may be basically immune from it, but may still be long-term carriers, not just for 2 or 3 weeks, but for longer? This could just keep going on and on. If it gets out of Africa, which Ebola's never done because they would never allow people out of Africa that had it, it seems like intentional that they're trying to have a cover story for why Ebola gets into the West.
I think you're absolutely right, Alex. It's that kind of scenario that is very concerning, and unfortunately, people may be, sharing space with these folks already. And unfortunately, with the international travel as it is now, and really kind of unregulated when screening for diseases like this, my thoughts are it's already here. And if we do have somebody who's resistant to the virus, then those people are going to be able to go farther and longer without detection. And you're absolutely right about that scenario.
Wow. A lot of medical doctors and virologists are saying that it's much worse than what the CDC or World Health Organization is saying. This top German virologist told Bild Friday that he believes 5 million people from the computer models they have will, and this is one of the top virology facilities in the world, 5 million will die. I don't know. I'm not a virologist. What does that sound like to you?
It sounds conceivable. I mean, it's happened before in our history. So, I mean, if something like the Spanish flu can wipe out gross swaths of population, then absolutely this can. And we're really not prepared for it. I think, unfortunately, a lot of Americans have their heads buried and think they're immune or protected, or it's not going to be me. And that kind of mentality doesn't allow for the vigilance necessary to pick this stuff up early and to deal with it appropriately. And there's going to be people who come into the ER and they're just going to be sent home either with antibiotics or, some treatment for the flu, and the next thing you know, they're going to go home to their family, contaminate them, and the cycle will continue. But absolutely, if this is truly something that now is possibly airborne, you're talking to millions that could be lost. There's no doubt about that.
Thank you so much for the call, Doctor.
You are watching the best of the Alex Jones Show, weekdays from 11 a.m. to 2 p.m. Central. Watch live at Infowars.com/show or become a member of InfoWarsNews.com and help us take resistance to the next level.